Good morning, students. We will continue the metabolism of carbohydrate, competition number 3.8, and today's topic is GTT, long form glucose tolerance test. Glucose tolerance test, otherwise also called as oral glucose tolerance test, OGTT, it is a non-physiological test. Why this is called as non-physiological test? Because during this test we are giving a glucose load of 75 gram of glucose orally to a person. Such large amount of glucose is not taken by the person in physiological conditions. Next, indications. Indication means when we advise this test. We will advise this test in two situations. First is impaired glucose tolerance. When we observe impaired glucose tolerance, then we go for this oral glucose tolerance test. Now, what is impaired glucose tolerance? When we perform a fasting and post-meal blood glucose of any person, and if the fasting blood glucose level falls between 110 mg per deciliter to 126 mg per deciliter, or post-meal blood glucose level falls between 140 mg per deciliter to 200 mg per deciliter, such condition is called as impaired glucose tolerance. In such person, to confirm diabetes mellitus, we will go for oral glucose tolerance test. The second situation, in woman with a history of more than 4 kg weight baby in the previous delivery. So these are the two indications, and contraindication is known case of diabetes mellitus. You cannot perform this test in known case of diabetes mellitus. In short, we will see the procedure of this test. Oral glucose tolerance test generally performed in the early morning. Ask the patient to visit at 8 a.m. and his fasting sample is collected. Fasting sample means a person have not taken anything by mouth for last 10 to 12 hours except water. So in this case, blood sample and urine sample is collected and denote it as 0 hour sample or sample number 0. Then glucose load is given to the person. 75 gram of glucose dissolved in 250 to 300 ml of water. The solution is prepared and ask the patient to drink. This dose is fixed for adults irrespective of their body weight. But in case of children, you can calculate the glucose load by 1.75 gram per kg of its body weight. When the patient drink this sugar solution, to avoid vomiting, ask him to drink slowly within 5 minutes. You can also add flavoring agent to this solution. After glucose load, you have to collect 2 more samples of blood and urine. One after 1 hour of glucose load and name it as sample number 1. The second after 2 hours of glucose load and name it as sample number 2. We have to collect both urine sample and blood sample. Now come to the interpretation. In case of blood sample, when the blood glucose level is less than 110 mg%, then it is normal. If blood glucose level is 110, it is diabetic, maybe diabetic. 1 hour glucose sample is important, that is sample number 1. If blood glucose level is less than 140 mg per deciliter, then it is normal person. But in case of diabetic person, the blood glucose level is more than 140 mg per deciliter. The blood glucose level is also collected after 2 hours, which is called as sample number 2. In normal person, the blood glucose level comes to the fasting state after 2 hours in sample number 2, but in diabetic person it is more than 110 milligram per deciliter. So this is interpretation. When the glucose load is given to a person, the glucose start rising in his blood and reaches the peak within 1 hour. But in case of post meal, when the patient eats food, then the peak blood glucose level is reached at the end of 2 hours. But here the peak is reached within 1 hour because glucose does not require digestion. Then after 1 hour, glucose starts decreasing in the blood and come to the normal blood glucose, that is fasting blood glucose level, by the end of 2 hours. This is due to secretion of insulin in response to elevation of blood glucose. In normal person, you cannot find glucose in any of the urine sample. Now coming to the urine sample, in case of sample number 0, the glucose is absent. In sample number 1 and 2, in normal person, the glucose is absent. But in diabetic person, you may or may not get glucose in the urine. Glucose in the urine is found when the blood glucose level increases above 180 milligram per deciliter. That 180 milligram per deciliter of blood glucose is also called as renal threshold value for glucose. That means when the blood glucose level increases above 180 milligram percent, then glucose starts appearing in the urine. So the presence of glucose in the urine is detected by Benedict test. So this is about glucose tolerance test and its interpretation. Thank you very much.